ที่ไหนเขาเปิดก็คือเห็นที่ไหนมาไม่ต้องเปิดดิเอาแค่เสียง
Okay, we are already.
Ajahn, maybe we will waiting for a while because our chief of foundation still not join yet.
Okay, we can waiting for them.
Thank you.
While for waiting, okay, I think we should introduce ourselves first.
Yes.
Yeah, I think that's nice. Okay, maybe start from maybe start from my college. Okay, from my director first.
Please. They introduce.
Good afternoon, everybody. My name is Suchadani Matanakun. I'm a director, Bolomaraj Chonani, Surin. ทำไมเสียงมันไม่ออกไม่รู้
Good afternoon. My name Dr. Supita Serawatanakul. I instructor in Moromraj Chonani College of Nursing Surin. Nice to meet you.
Good afternoon. Nice to meet you, Ajahn.
Hello, good afternoon. My name is Thidarat. I am lecturer of mental health nursing from Bomrachani College of Nursing Surin. Nice to meet you all.
Good afternoon, Ajahn. Nice to meet you too.
Yeah.
Good afternoon. My name is Yavarat M.O. I am gonna be moderator at the 21st December.
Nice to meet you, Ajahn.
Nice to meet you all. Okay, maybe our member in this room around 6 people, and then maybe next step is we want to know about your member there. Please introduce yourself.
Okay, thank you, Ajahn. I will introduce myself and my member, but my member will introduce themselves by them Zoom because they have joined with the Zoom for their PC or laptop. So I will introduce myself first. My name is Siska Mayangsari, and I'm Dean of Nursing Program of STIKes Hang Tuah Pekanbaru. Sawadika. Next.
Okay, I will introduce myself. Sawadika. I'm a lecturer from community health nursing STIKes Hang Tuah Pekanbaru. Sawadika, Achan.
Nice to meet you.
Nice to meet you too.
Okay, good afternoon. My name is Sukani Niria, and I'm a lecturer in STIKes Hang Tuah Pekanbaru. Nice to meet you.
Nice to meet you.
Hello, good afternoon. My name is Dewi Kurnia Putri. I'm lecturer mental health nursing in STIKes Hang Tuah Pekanbaru. Nice to meet you.
Open your mask, please.
Okay.
Wait.
Hello.
Okay, please, Mrs. Sandra. Yeah.
Good afternoon. Hello.
Yeah. Good afternoon.
I am Thularat Hauhan.
Hello, Ajahn Chulara.
สวัสดีค่ะ สวัสดีค่ะ Sorry, I'm late.
Okay.
Just like I'm running from the hospital.
Okay, it's okay.
Okay. Yeah.
I will introduce my member. Next, Mrs. Sandra, please. Okay.
Oke.
Iya, Bu Sandra sudah bisa bicara? Sudah? Ya, sudah. Silakan.
Okay, my name is Sandra. I'm lecturer 2 in STIKes Hang Tuah Pekanbaru. Nice to meet you too.
Yeah, nice to meet you.
I'm medical nursing in STIKes Hang Tuah Pekanbaru. Nice to meet you.
Next. Yes, Bella, please. Pak Asep, tolong Bu Vela.
อาจารย์ธวัชชัย ไม่ได้ยินไหมนะ
Hello. อาจารย์ธวัชชัย Can you hear me? อาจารย์ธวัชชัย Can you hear me?
Yeah.
Yeah. อาจารย์ธวัชชัย No, we just like from Thailand. Right now we have another group of faculty member and students who attend the Zoom meeting from the community hospital.
I'm sorry, what do you mean?
Hello ครับ
Okay. อาจารย์ธวัชชัย Yes, please introduce yourself and student too.
Why? Sorry. Hello everyone. My name is Thawachai Yao, and my student.
My name is Thidarat.
Hello, nice to meet you.
Nice to meet you too.
Okay. I'm sorry, we're still waiting for our Chief of Foundation, Dr. Zainal Abidin, to joining this Zoom.
ได้ยินไหม
จะนำเสนอเป็น
ได้ยินเสียงหมอ
Maybe we have time for introduce my members, the other members. Please, Mrs. Bella.
Okay, I'm Vela Yovina from STIKes Hang Tuah Pekanbaru. I'm from maternal department. Nice to meet you all.
Okay, nice to meet you too.
Thank you. Next, Mr. Tengku Abdul Rashid, please.
Hello everyone, I am Tengku Abdul Rashid, lecturer of emergency nursing. I will be the moderator in 18 December 2020. Sawadee-ka, nice to meet you all.
สวัสดีค่ะ Nice to meet you สวัสดีค่ะ
Okay, thank you. Next, for Miss Dian Rosa Adila, please.
Hi everyone, my name is Dian Rosa Adila. I'm lecturer in STIKes Hang Tuah Pekanbaru. I'm in maternity of nursing. Nice to meet you.
Nice to meet you.
Okay, next, Mrs. Agnita Utami, please.
Hello, good afternoon. My name is Agnita Utami. I'm lecturer in pediatric nursing in STIKes Hang Tuah Pekanbaru. Nice to meet you.
Nice to meet you.
Yeah, we have another lecturer. Mrs. Raja Fitrina. Hello. Mrs. Raja. Or Mrs. Yechi Anggreni. Okay.
Hello. Okay.
Yeah, hello.
Good afternoon.
Hello.
I'm lecturer of nursing management. Next lecture. Thank you.
Nice to meet you.
Okay, thank you, Mrs. Yechi Anggreni, lecturer of nursing management of nursing. Next, Mrs. Raja Fitrina.
Yes, I'm.
Yourself.
Okay. Good afternoon, everyone. My name is Raja Fitrina Lestari. I'm in lecture in nursing management. Sawadee-ka.
สวัสดีค่ะ Nice to meet you.
Nice to meet you too.
I think they are still the other, but maybe they not joining this Zoom yet. Wait, I will check for Mr. Zainal, still not joining yet. Is that the other? Mr. Rahman, Abdurrahman? Did you joining this? No? Hello, Mr. Abdurrahman Hamid. Please introduce yourself. Okay. Oh yeah. He is driving a car, so I'm sorry to not introduce himself. Wait a minute. Kok belum juga Pak Zainal ya. Oke. Udah masuk? Hah? Sudah, link sudah. Ah, Isis Erna Marni. Oke. Hello, good afternoon, Dr. Zainal Abidin. Okay. Ajan?
Yes.
Yeah, Dr. Zainal Abidin have joined the Zoom, so maybe we can start the event.
Okay. Yeah. Okay, we are ready.
Okay, thank you.
Assalamualaikum warahmatullahi wabarakatuh. Sawadika. Good afternoon, ladies and gentlemen. Welcome to the first day virtual guest lecture series collaboration program between BCN Surin, Thailand and STIKes Hang Tuah Pekanbaru, Indonesia. Honorable Chief of Hang Tuah Pekanbaru Foundation and Daily Manager and Treasurer. Honorable Director of BCN Surin, Thailand. Honorable Head of STIKes Hang Tuah Pekanbaru. Honorable all speakers, guest lecture from Nursing Program of STIKes Hang Tuah Pekanbaru and BCN Surin, Thailand. Due to implementation of collaboration program of both institutions. My respect for all Vice Chairman of STIKes Hang Tuah Pekanbaru, Indonesia, and Head of Collaboration Unit of STIKes Hang Tuah Pekanbaru. Honorable Dean of Nursing Program of STIKes Hang Tuah Pekanbaru and all of the lecture. Honorable Dean of Faculty of Nursing of BCN Surin, Thailand, and all of the lecture. And dearest nursing student of STIKes Hang Tuah Pekanbaru and BCN Surin, Thailand. First of all, let's praise to Allah Subhanahu wa Ta'ala for His blessing and mercy, so we can attend and join in this virtual meeting. And also, let us greet and pray to our beloved Prophet Muhammad Sallallahu Alaihi Wasallam, who brought us to the path of light and left the darkness by saying, Salawat Allahumma salli ala Muhammad wa ala ali Muhammad. Today is a great honor for us to be here and welcome every one of you in his event. Give applause, please. Everyone, let's begin this opening ceremony by saying Basmalah. Bismillahirrahmanirrahim. Okay, before beginning the event, I would to remind of all audience, please mute the microphone and turn on your camera during the meeting, so that this event could running well and success without any obstacle. Ladies and gentlemen, next agenda is welcoming speech from Dean of Nursing Program of STIKes Hang Tuah Pekanbaru, Mrs. Narsiska Mayangsari M.Kep. Time is yours.
Okay, thank you, Mrs. Sekani. You can hear me?
Yes.
Okay. Bismillah. Assalamualaikum warahmatullahi wabarakatuh. Sawadika.
Sawadika.
Honorable Chief of Hang Tuah Foundation, Mr. Dr. Zainal Abidin MPH. Honorable Head of STIKes Hang Tuah Pekanbaru, Indonesia, Mr. Ahmad Hanafi, SKM MKes. Honorable Director of BCN Surin, Thailand, Mrs. Sushada Nimwat Tanako. I'm sorry if misspelling your name, Mrs. I'm glad to see you again this Zoom meeting. How are you, Ajam?
Thank you.
We are doing very great, and
yeah.
Right now we have it's like a school. The first week of third year student to have a practicum at the hospital.
Yeah.
So, and right now we have class in classroom and in the practicum.
Okay. Yep. Next, thank you. The honorable all speakers in guest lecture nursing program of STIKes Hang Tuah Pekanbaru, Indonesia, and BCN Surin, Thailand, due to implementation of collaboration program of both institutions. The Honorable All Vice Chairman of STIKes Hang Tuah Pekanbaru, Indonesia, and Head of Collaboration Unit of STIKes Hang Tuah Pekanbaru, Indonesia. the Honorable Dean of Faculty of Nursing of BCN Surin, Thailand, and all of the lecturers and the instructor, clinical instructor from BCN Surin, Thailand, the Honorable all lecturers of nursing program of STIKes Hang Tuah Pekanbaru, Indonesia, and former lovely students and the next nurse field professionals, the nursing students of STIKes Hang Tuah Pekanbaru, Indonesia, and BCN Surin, Thailand. Alhamdulillah Rabbil Alamin, thanks to our God who has given us healthy so we can join this virtual event with great enthusiasm. And also let's greet our lovely Prophet Muhammad Sallallahu Alaihi Wasallam by saying Allahumma salli ala Muhammad wa ala alihi Muhammad. Hello everyone, how are you? Let me introduce myself first. My name is Siska Mayangsari, and I am Dean of Nursing Program of STIKes Hang Tuah Pekanbaru, Indonesia. Today, I am so delighted to see you and greet all of you by this virtual meeting. And thank you very much for all the invited guys, all students, and all lecturers and instructors who's already joining this Zoom meeting today. First of all, I want to say thank you for the director of BCN Surin, Thailand, and the Dean of Faculty of Nursing, who's willing to choosing us, STIKes Hang Tuah Pekanbaru, Indonesia, as your partner for the collaboration program under facilitated by Prabowo Maruchanok Institute Ministry of Public Health Thailand, PBRI Thailand, and Association of Institution Nurse Education Center Indonesia, INEC, on last November 10, 11, 2019. And that day, there was also signing Memorandum of Understanding, MOU, and Memorandum of Agreement, MOA, between both institutions. This MOU is very meaningful for the improving effort of nursing education program in STIKes Hang Tuah Pekanbaru, Indonesia, so that we already had a planning to conduct the students and faculty exchange on March 2020. Actually, we have prepared for this, but unfortunately, the pandemic COVID-19 was come without any invitations. So, and it's still occurred till today. In Indonesia, in Pekanbaru city of Riau province, in my province. But the pandemic COVID-19 is not be an obstacle for our effort to improving the nursing program. So by doing the communication by messenger with Ajahn Solaret, we commit to change the planning, and the virtual guest lecturer series is the exactly alternative that we can do in these situations. So that is the background why this virtual event held today and for December 18 and 21, 2020. These virtual guest lecturer series are divided to 3 days. First day, our opening ceremony days on December 15, 2020 is about mental health nursing, which will delivered by Dr. Thidarat Kanoungpien. I'm sorry with misspelling your name, from BCN Surin, Thailand, and Nurse Dewi Kurnia Putri M.Kep from STIKes Hang Tuah Pekanbaru, Indonesia. The second day on December 18, 2020 is about medical surgical nursing, which will deliver by Dr. Sarinya Posing Chan from BCN Surin, Thailand, and Nurse Rani Lisa Indra M.Kep, SPKEP MB from STIKes Hang Tuah Pekanbaru, Indonesia. And the last day, our closing ceremony is on December 21, 2020, is about maternity nursing, which will be delivered by Dr. Cholarat Sainat Hauhan from BCN Surin, Thailand, and Nurse Vela Yovina Tobing M.Kep, SPKEP MAT from STIKes Hang Tuah Pekanbaru, Indonesia. For last day, it will be conducted by BCN Surin, Thailand. Its virtual guest lecture will attend by all students of STIKes Hang Tuah Pekanbaru and also students from BCN Surin, Thailand. Based on our MLA, our collaboration will be valid until 5 years. It means 2019 until 2024. So maybe we should have more intent consult each other to develop the cooperation to a specific planning, such as exchange of teaching staff, lecturers, and researchers, exchange students, exchange of academic information and publications, conducting reciprocal lectures and seminar, maybe international seminar, cooperating in research and publication of its results, or identifying other mutually agreed opportunities for collaborations. And I think for the first year of our collaboration is already done by this virtual guest lecture series. We have for the next 4 years, we have a great planning for our collaboration. It might be joint research, international seminar or publication, and of course, students and faculty exchange either. This collaboration will not be running well without commitment between BCN Surin, Thailand and STIKes Hang Tuah Pekanbaru, Indonesia. This collaboration program also not running well without support system from the managerial of STIKes Hang Tuah Pekanbaru and also from Hang Tuah Pekanbaru Foundation. So thank you very much, sir, for the support. We promise to perform this credibility to make a better nursing program of STIKes Hang Tuah Pekanbaru, inshallah. So for the nursing students of STIKes Hang Tuah Pekanbaru who want to go to BCN Surin, Thailand to student exchange next years, please raise your hand. Untuk mahasiswa STIKes Hang Tuah Pekanbaru, ada yang mau ikut pertukaran mahasiswa ke Thailand tahun depan? Silahkan, kalau ada angkat tangannya. Fauzan Izadi udah raise hand ya. Oke, Fauzan Izadi, inshallah next year we will conduct the student exchange, right? Inshallah. So if you want to join the student exchange to BCN Surin, Thailand, you should to prepare yourself first, especially in English skills and academic skill, of course. For the faculty or the lecturer, this MOU give us chance to develop our paradigm of nursing education and also to increase our lecturer partnership in education, research, and publication. So the students, please enjoy the virtual guest lectures. I hope you joining all the time so it could develop your nursing knowledge and skill to be a professional nurse. So let me praise dua and pray to Allah SWT, to our God, toward this pandemic COVID-19 will disappear in all over the globe in our country so that we could do daily activity as usually, as normally, and of course we could conduct the student exchange, the faculty exchange, and the other kind of partnership activity between BCN Surin, Thailand and STIKes Hang Tuah Pekanbaru, Indonesia directly, face to face, visiting each others. Amin ya Rabbal Alamin. Last but not least, thank you very much for the committee from the nursing program and the IT from STIKes Hang Tuah Pekanbaru, Indonesia, and also from the committee of BCN Surin, Thailand, who organize and conduct this event. And we hope the event will running well and success to the end. Amen. Finally, that's all my speech. I am apologize to the inconvenience during my speech. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Sawadee krap.
Thank you, Mrs. Siska, for your speech. For the next welcoming speech from Head of STIKes Hang Tuah Pekanbaru, Mr. Ahmad Hanafi, SKM M.Kep. Time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Sawadika. Honorable Chief of Hang Tuah Pekanbaru Foundation, Daily Manager and Treasurer, Honorable Director of BCN Surin, Thailand. My respect for all speakers in guest lecture from nursing program of STIKes Hang Tuah Pekanbaru and BCN Surin, Thailand, due to implementation of collaboration program of both institutions. My respect for all Vice Chairman of STIKes Hang Tuah Pekanbaru and Head of Collaboration Unit of STIKes Hang Tuah Pekanbaru. Honorable Dean of Nursing Program of STIKes Hang Tuah Pekanbaru and all of the lecture. Honorable Dean of Faculty of Nursing of BCN Surin, Thailand and all of the lecture. And my dear nursing student of STIKes Hang Tuah Pekanbaru and BCN Surin, Thailand. First of all, let's praise to Allah Subhanahu wa Ta'ala for His blessing and mercy, so we can attend and join in this virtual meeting, and also let us greet and pray to our beloved Prophet Muhammad Sallallahu Alaihi Wasallam, who brought us to the path of light and left the darkness in this life by saying Salawat Allahumma salli ala Muhammad wa ala ali Muhammad. It is my pleasure and happiness to see you in this online class meeting or conference without any doubt we can hold this international event. Based on our data, on last November 2019 was a signing of MOU between STIKes Hang Tuah Pekanbaru and BCN Surin, Thailand, which facilitated by PBRI, Thailand, and INEC. Therefore, we want to say great thank you for both institutions who assist and organize this event for their lofty aim for enhance the human resources quality through benefit collaboration. At the beginning, we have committed to conduct the student and faculty exchange on March 2020 as the feedback of the MOU, but the pandemic COVID-19 make it should postpone for a few months. Even though the pandemic still not over yet, we have committed to hold the virtual meeting international online class guest lecture with them optimizing resources toward excellent nursing program. This event aims to encourage the student knowledge and paradigm for special nursing science specification, who will deliver by competent speaker from BCN Surin, Thailand and nursing program of STIKes Hang Tuah Pekanbaru. Thank you very much for all speakers who kindly helping in this event to share their valuable experience knowledge, and for all students who has chance to joining this event. I hope all of you following this event all the time and willingly, so you could understand the transfer of knowledge very well from our speaker. I think that all that I could to say. Thank you very much for the committee from nursing program and IT team who organize and conduct this event. We hope the event will running well and success to the last day. Amin. Bila taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Sawadikap.
Waalaikumsalam warahmatullahi
สวัสดี
wabarakatuh.
ค่ะ
Mr. Ahmad Hanafi, thank you for the speech. And next, ladies and gentlemen, now we are listening for a speech of Chief of Hang Tuah Foundation, Mr. Dr. Zainal Abidin, Master of Public Health. Time is yours.
Thank you, ma'am. Ladies and gentlemen, good afternoon all. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi.
Sawadikap.
สวัสดีค่ะ
Honorable the Head of STIKes Hang Tuah Pekanbaru, Honorable Director of BCN Surin, Thailand, Honorable speakers from Nursing Program STIKes Hang Tuah and BCN Surin, Thailand, Honorable Vice Chairman STIKes Hang Tuah Pekanbaru, Head of Collaboration Unit of STIKes Hang Tuah Institute, ladies and gentlemen, dearest nursing students and BCN Surin in Thailand. First of all, let me praise to our God, Allah Subhanahu wa Ta'ala, for blessing us so we can attend this meeting and join the virtual meeting because of the COVID. And let us always greet and pray to our beloved Prophet Muhammad by saying Allahumma salli ala Muhammad. Highly demand of health workers, especially nurses in Rio province, is a main reason for STIKes Institute to establish nursing program of 29. Nursing program STIKes Hang Tuah Pekanbaru was having incredible progress since 29 until now. The nursing program also following the national education development, especially nursing education. It's supported by membership of the Association of Indonesian Nurse Education Center. Since Asian Economic Community established on 2015-2016, each education institution in Indonesia challenged to enhance education quality to produce the graduate competitive in Asian countries, so that STIKes Hang Tuah Institute in Pekanbaru performed several international collaboration to sharing experience in education system, such as PUM in Netherlands, Amsterdam, Malaysian, Philippines, Scholar University, and currently with your country, Thailand. So we hopefully this collaboration between STIKes Institute Pekanbaru in Riau and BCN Surin, Thailand will give good impact and having benefit for both countries, both school, for nursing education quality, and also could be a valuable experience for our students, our faculty, and our teachers. Well, congratulations, and we will use collaboration with running well and success. Thank you for your collaboration. God bless us. Amin. We meet you until COVID end. Thank you very much, both of you. Good afternoon. Thank you.
A big hand หน่อย
Sawadikap. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
สวัสดีค่ะ
Mr. Zainal Abidin, thank you for the speech. And now we are going to watch video profile of STIKes Hang Tuah Pekanbaru. Here we go.
province is one of largest provinces in Sumatra Island, within variety ethnic typical Malay culture. STIKes Hang Tuah Pekanbaru is the #1 Institute of Sciences in Riau Province.
Let me introduce you the Institute of Public Health Hang Tuah Pekanbaru. Institute of Health Science Hang Tuah Pekanbaru. Institute of Science Hang Tuah Pekanbaru is managed by Hang Tuah Pekanbaru Foundation. Besides Institute of Health Science Hang Tuah Pekanbaru, there is also Institute of Computer Management Science Hang Tuah Pekanbaru. The history of the school. At the beginning, by the idea of Governor of Riau Province, Mr. Saleh Jasid, to establish the higher education health science in Province Riau. Then it had been held the meeting with Vice Governor Riau, Rector of Riau University, and the Chairman of Provincial Health Officer, Dr. Zainal Abidin M.Ph, the General Director Arifin Ahmad Hospital, Dr. Andi Jaina. Then the government established Medicine Faculty in Riau as a priority, the history. Meanwhile, Mr. Dr. Zainal Abidin, Minister of Public Health, has pretension to establish the public health and medical record and health information science system, which managed by foundation, so that his presentation supported by Vice Governor of Province Riau. Then Mr. Zainal Abidin M.Ph, accompanied by Mr. Muhammad Sukri, Chief of Administration and Provincial Health Office, conducted a proposal to establish the new health science by form of foundation which named Hang Tuah Pekanbaru on 9 November 21. Structure organization of Hang Tuah Pekanbaru Foundation. Dr. Zainal Abidin MPH, Chief, Muhammad Sukri, Secretary, and Marlis Kalesot.
STIKes Hang Tuah Pekanbaru memiliki visi terwujudnya institusi yang unggul dan kompeten dalam penyelenggaraan pendidikan tinggi kesehatan yang berbasis teknologi tepat guna dan mampu bersaing di tingkat nasional dan regional tahun 2036.
STIKes Hang Tuah Pekanbaru provide Bachelor of Public Health, Diploma of Medical Record and Health Information, Bachelor of Nursing, Nursing Profession, Nurse Internship, Diploma of Midwifery, Diploma of Dentist, Master Program of Public Health, Bachelor of Midwifery, Midwifery Profession, Midwifery Internship. Together, we can make better and healthy Indonesia.
STIKes Hang Tuah Pekanbaru is the #1 of STIKes in Riau Province, Indonesia. We're proud of that. Okay, now we are going to the welcoming speech from Director of Boromarojonani College of Nursing, Surin, Thailand, Mrs. Shushada Nimwatanakul. Sorry for misspelling. It's time for you.
สวัสดีค่ะ Good afternoon. Dean of Nursing Program of STIKes Hang Tuah Pekanbaru, Head of STIKes Hang Tuah Pekanbaru, Chief of Hang Tuah Pekanbaru Foundation, staff, students from STIKes Hang Tuah Pekanbaru, Deputy Director of Boromarajachonani College of Nursing Surin, faculty members, staff, and nursing students, and Boromarajachonani College of Nursing Surin. On behalf of the organizing team of the workshop, I would like to take this opportunity to express our sincere thanks and appreciation to honor with your presence to preside over the opening ceremony of the workshop. This workshop really great. Boromarajachonani College of Nursing Surin Faculty of Nursing is a higher education institute with 5 main missions, namely to produce nursing graduates, to produce researchers, to develop nursing knowledge, to offer academic contribution to the society, to preserve culture, and to strive for academic excellence. To be able to achieve this mission, the college had to adjust itself to the new trend and try to learn new knowledge and adjust strategic direction. In working to match with change in public health in situation, nursing education and development of Asian country. Due to the aforementioned reason, the college has placed importance to developing quality and standard and producing good quality researcher, as well as trying to find possible cooperation and exchange of academic works in international level. In doing so, the college needs to train and develop faculty, staff, and public health personnel and students to enrich their knowledge and to let them learn more about change in healthcare situation, both domestically and internationally. It is very great pleasure for Boromarajachonani College of Nursing Surin to have a memorandum of agreement on the academic exchange program with Institute of Health Science Hang Tuah Pekanbaru. Under this MOU, there are lots of activity to promote a joint relationship between us. The today online conference aims at exchanging knowledge in nursing patients with mental health, patients with kidney disease, and nursing care during labor and delivery. On behalf of Boromarajachonani College of Nursing Surin, Faculty of Nursing, Boromarajachonok Institute, I would like to extend to you my congratulations on the occasion of 3-day program or lecture related to nursing care. It is my earnest belief that this existing bond of friendship and cooperation between our two institutes will be even more flourished in the years ahead of our mutual benefit. I am very glad to meet you again. Specials, Dean of Nursing Program of STIKes Hang Tuah Pekanbaru, Miss Siska. Thank you very much.
Thank you very much, Ajahn.
Thank you.
Muter lah. Salah nih. Itu di sebelah sana tadi tuh. Atau bukan jalan raya tadi tuh, nak. Itu tuh tadi tuh. Muter lah, Mas.
Aku pikir muter kepala gitu aja. Aduh.
Okay. So
Dia masih
So, as you can see from the video presentation, that for university under Ministry of Public Health Thailand,
we have 30 nursing college and 7 public health college located in different provinces throughout the country. And so, next slide, please. So, Balom Ratani College of Nursing Surin, we established since 1979. So this year we like a 48 years old. At first, we established and had the former name was School of Nursing, Midwifery and Health because of the shortage of nurse profession during the war at that time. And in 1980, we transferred to the responsibility of the Pabulom National Institute for Health Workforce Development. And at that time, Pabulom National Institute under the office of Under Secretary of Ministry of Public Health. And in 1994, we changed the name to Balom Ratani College of Nursing Surin. And from last year, we are a university. Balom Ratani is the King Grandmother privilege given in 1994. Next. And for the flower of the college, is a butterfly bush. So because Surin is we call like a land of elephant, and so you can see that the shape of this flower look like it's like from the part of the elephant. So this flower represent the moral of the college, and white also embody the good faith, ideology, and high spirit. And its bush is like a cement of the unity. So that's the meaning of this flower. Next slide, please. So as our director mentioned in her welcome speech that for our college, we have like 6 obligations. The first is developing and managing professional nursing education. The second is conducting research. And the third is like training or capacity building for healthcare professional. And we also have the academic service to the communities. And other thing is like we have to have the activities aiming for inculcate democratic, moral, ethics, and social development. And the last one is promote excellent organization. Next is so. Our college identity is we believe that our students will be professional in their career and be able to understand surrounded people and community and be responsible and providing care with the humanizations. So our aim is moral and wisdom lead to the best quality of nursing education. So for our share value is from Surin. So S represents sufficiency and system thinking. U represent unity. R represent responsibility. I represent integrity, and N represent neutral. And so right now the director of our college is Ajahn Suchada Nimwatanakul. And we have around 51 nursing instructors, and actually it should be right now we have 8 who have like a doctoral degree, and maybe by the end of this year we have 9. And we have right now actually we have about 40 back office who help us to organize our college. Next slide. So education, we have only one program for nursing education. Is about bachelor degree in nursing science. It's a 4-year full time. So the requirement is high school student who graduate at Matayom 6 or grade 12 and being healthy without disease. That would be the obstacle to the study and nursing practice. Okay, next. Oh. Okay. And so For our curriculum, we have three main parts. It's a general subjects, nursing subjects, and independence. Right. Next slide. And for the teaching and learning method, we use several active learning methods, such as active lecture, problem-based learning, community-based learning, research-based learning, and problem-based learning, and SBL. And for the clinical practice, nursing students have to do a practicum in Surin Hospital, which located near the college, and Buriram Hospital, community hospital in Surin and Buriram areas, health promotion hospital that located in Surin Hospital, in Surin province, and community setting both in urban and rural area. Next. So graduate will be awarded at the Bachelor of Nursing side. And right now, our college accredited by Thailand Nursing Council for 5 years. Next slide. And so for facility, because all of nursing students have to stay in dormitory that we provide for all students. So we try to promote the beautiful and suitable circumstance for the college. And for taking care of students' life, we apply the virtual family. So when you come visit us, we will show you how we do with we call as like a virtual families. And for the training programs, we have a lot of training program for healthcare professional, such as program on nursing specialty in nurse practitioner, first line public health administrators, program of family nurse practitioners, and training for nurse preceptor. Other is about capacity building on for elderly with non-communicable disease. And yes, we have to do the research. And we have a lot of research. And if you go to the website of our college, you can see some of research paper. So this, I think when we to discuss about what kind of research we can do together, we can develop our research proposal based on two major areas. It's about for the nursing clinical and about nursing education. Okay, next slide. And yes, we have like an international cooperation. So we have like a MOU with Hang Tuah Pekanbaru, Indonesia. And we have another international cooperation with National Cheng Kung University and Asian and Pacific Alliance for Nursing Education. So maybe in the future we can have like a third party to do like an international activity together. And you can see that we have a lot of student affairs from this picture, and most of them is related to Thai culture. And we have academic service. We have to go to provide like a nursing care and healthcare to people in the remote area as well. And next slide. And for the academic service, we integrate academic service with nursing care for elderly subjects. So I just hope that when we plan to do like a student exchange, we can looking for the good time that your student can join our students activity, that when we do academic service for the elderly in the community. And we have another activity such as for like a children day or World Elephants Fair. That's really famous for Surin. And you can see from this picture is like a cultural activity during the Songkran Day. Songkran Day in Thailand is really famous. So it's a day that we can splash water to each other. That's very fun activity. I love that. And other, we have like a moral college as well. Okay. So that's all for like I just brief introduce about my college. Thanks.
Thank you, Mrs. Sushada, for your speech and profile of Boromarojanani College of Nursing, Surin, Thailand. That is a great school. It's our honor having collaboration with BCN Surin, Thailand. Ladies and gentlemen, next agenda is photo session. Please give your good smile in the Zoom. We will take some picture from Zoom meeting. The photo session will guide by IT team of STIKes Hang Tuah Pekanbaru. Mr. Denny, please.
Okay, thank you. Let's pick one.
Okay, let's we have to change our position first. We just want to stand together for a good picture moment. ไปแล้วยืนค่ะเขาจะถ่ายรูป
Yeah, yeah.
Okay, Ajan, okay.
Okay, next. Next. Oke, Bu, finish.
Pak Denny. Pak, belum Pak, lanjut Pak. Mereka apa masih ini, masih senyum. Ya, lanjut. Semua. Oke, Pak Den, finish.
Oke, finish, Bu.
Thank you, Mr. Denny. All these participants. Finally, now we come into the main point in first day virtual guest lecturer series. Collaboration program between BCN Surin, Thailand and STIKes Hang Tuah Pekanbaru, Indonesia. The first day is in mental health nursing class. We are fortunate to have two prominent and professional speakers today, and we will be guided by a moderator to listen about the seminar and discuss more in the question and answer session. It is now my pleasure to introduce the moderator. The moderator of the day is Nurse Eka Wisanti M.Kep, SP-Kepkom. Ms. Eka is nursing lecturer in nursing program of STIKes Hang Tuah Pekanbaru, and also as head of Community-Family-Geriatric and Mental Health Nursing Department in nursing program of STIKes Hang Tuah Pekanbaru. Ms. Eka graduated her magister and specialty of community nursing in Universitas Indonesia. Okay, for the guest lecture session, please welcome Ms. Eka Wisanti as the moderator. Ms. Eka, it's time yours.
Okay, thank you, Mrs. Sokani, for introducing me. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Sawadika, and good afternoon all. Today, as moderator, I will facilitate you in the speaker presentation and discussion session. And now we have two guest lecture from BCN Surin, Thailand, and STIKes Hang Tuah Pekanbaru. And the first speaker from BCN Surin, Thailand is Dr. Thidarat Kanoungpien. Sorry for misspelling your name, Achan. Sawadika.
Nice to meet you.
Nice to meet you too. And Kopunka for coming in virtual classroom today.
That's so nice.
Okay. I will inform our first speaker, Dr. Thidarat Kanoungpien.
Yeah.
She is a lecturer from BCN Surin, Thailand. Her administrative position as head of Department of Mental Health and Psychiatric Nursing. Her education history get bachelor degree from Bachelor Degree of Nursing Science, BCN Surin, Thailand, affiliated with Konkan University, Thailand, and get master degree from Master Degree of Mental Health and Psychiatric Nursing in Mahidol University, Thailand, and get doctoral degree from Philosophy of Nursing, Chiang Mai University, Thailand, and her specialty area in mental health missing in mental health
University,
management.
Thailand.
Yeah, sorry, I'm missing it. And specialty area in mental health of caregiver, schizophrenic care, and psychotic symptom management, and elderly mental health care, qualitative research, and grounded theory methodology. And her experience in teaching are mental health and psychiatric nursing care for student nurse, teaching and counseling, nursing innovation, trend and nursing development, principal and technical nursing, and nursing research. Her speaker and expertise focus in mental health and psychiatric care. Okay, that is from information about our speaker today. Furthermore, before we start to virtual class, I will share the question format in Zoom Messenger. If you can have a question, you can typing in there. Back to the point, even. Bentar, Pak. Aku harus keluarin ini. And back to the point, even the first speaker with presentation about how to care patient with mental health problem by Dr. Thidarat, lecturer from BCN Surin, Thailand. Please welcome Achan. Time is yours.
Thank you for introducing myself. Good afternoon, everybody. Nice to meet you all again, and thank you for warm welcome. I'm delighted to be here today to talk to you about how to care for patients with mental health problems. What are some ways nurses can help mentally ill patients? A nurse duty is to administer holistic care, and that may include addressing a patient's mental state. Not all registered nurses are prepared in psychiatric nursing, but they still have a responsibility to provide care for mental ill patients and help them to obtain treatment for psychological distress. Nurses may deal with patients who are either showing signs of or are at risk of developing mental illness. Patients with mental illness can display a wide range of symptoms, include dependency, aggression, violence. Therefore, I would like to discuss about this topic to you all. My talk is divided into three parts. I will start with understanding mental health and mental illness. Then I will look at principles of mental health and psychiatric nursing. And finally, I would like to talk about staying mentally healthy during COVID-19 pandemic. Before I start, I just like to give you some background information about this topic. As you are all aware, a person cannot be healthy without being mentally healthy, but it is possible to be mentally healthy and have mental or physical disorder. Mental health is essential to personal well-being, interpersonal relationships, and contributing
to the community. First of all, what is mental health? Mental health is an integral and essential component of health. The WHO Constitution states health is a state of complete physical, mental, and social well-being and not merely the absence of disease or infirmity. An important implication of this definition is that mental health is more than just the absence of mental disorder or disabilities. Mental health is fundamental of our collective and individual ability as humans to think, emotion, interact with each other, earn a living, and enjoy life. On this basis, the promotion, protection, and restoration of mental health can be regarded as a vital concern of individual, community, and society throughout the world. The concept relates to the enjoyment of life, ability to cope with stress and sadness, the fulfillment of goals and potential, and a sense of connection to others. Mental health is about wellness rather than illness and is not merely the absence of a mental health condition. Like a physical health, mental health is not fixed. Mental health exists on a continuum or rank from positive, healthy functioning at one end through to severe symptoms of mental health condition at the other. For mental illness, mental illness is a condition that affects a person's thinking, feeling, behavior, or mood. These conditions deeply impact day-to-day living and may also affect the ability to relate to others. A person's mental health moves back and forth along this range during their lifetime in response to different stressors and circumstances. At the green end of the continuum, people are well, showing resilience and high level of well-being. Moving into the yellow area, people may start have to difficulty coping. In the orange area, people have more difficulty coping and symptoms may increase in severity and frequency. At the red end of the continuum, people are likely to be experiencing severe symptoms and may be at risk of self-harm or suicide. For influencing factor of mental health, is have risk factor and protective factor influence mental health and can move people back and forth along with continuum. They can be individual or related to family, work, or other life circumstance. Risk factor may increase the strain on our mental health, while protective factor can counteract this by helping us to stay or become well. Each illness has its own symptoms, but common signs of mental illness in adults and adolescents can include the following for common signs of mental illness. For example, excessive worrying or fear, feeling anxiety, sadness, or low, confused thinking or problems concentrating and learning. And extreme mood change include uncontrollable high or feeling of euphoria, sometimes it's so mania, prolonged or strong feeling of irritability or anger, avoiding friends and social activity, difficulty understanding or relating to other people, changing in sleep habits or feeling tired, low energy, changing in eat habits such as hunger or appetite and changing in sex drive too. Furthermore, they might have difficulty for perceiving reality. Example, delusion, hallucination, in which a person experiences things that not exist in objective reality. Inability to perceive change in one's own feeling, behavior, or personality, for lack of insight or agnosia, overuse of substance, for example, like alcohol or drug. And they might have multiple physical alignment without obvious cause, such as headache, stomach ache, and ongoing ache and pain, everything in their body. Things about suicide and inability to carry out daily living or handle daily problems and stress, and intense fear of weight gain or concern with appearance. Furthermore, common sign of mental health or mental illness in children. They changing in school, if they changing in school for performance, excessive worry or anxiety. For instance, fight to avoid bed or school, hyperactivity behavior, frequent nightmares, frequent disobedience or aggression, frequent temper tantrums. So if you saw people have signs and symptoms as I explained before, you will recognize and concern about they may have mental illness. As we know, the various mental illness may be seen in patients, for example, schizophrenia, bipolar, PTSD, etc., anxiety, depressed. Therefore, as nurse, to care a person with mental illness, we can concern principle of mental and psychiatric nursing that I will explain the detail. Right, let's move on to learn with principle of mental health and psychiatric nursing as follows. First of all, accept patients as exactly as they are. Acceptance is important in nursing, that mental health nursing, because you will care for many people who are different, but they must be accepted. Acceptance does not mean accept inappropriate behavior, but accept the person as worthy. Nurse must set boundaries for behavior by being clear and firm without anger or judgment, and convey that certain behavior is unacceptable. And the nurse spend more time with client listening to him, hear what he's saying, and understand the meaning what he said. Furthermore, acceptance patient is an active process. We showing acceptance by we not judgmental and not punitive. We don't judge patients' behavior as right or wrong, or good or bad, or direct or indirect method of punishing must be avoided. The patient is not punished for his undesirable behavior. And we should listening to patient. Another meaning of acceptance. Listening to is more than keeping quiet. Include hearing what he's saying and understanding the meaning what is said. Permitting the patient to express emotion. Patients has negative emotion and need to express this emotion without psychological or physical danger to them and others, and these emotions are in need of an outlet. In fact, the ability of the patient to express a negative emotion is often a very healthy sign. Second, understand. It means self-understanding. Self-understanding leads to understanding of others' behavior and to be aware of why he behaves as he does, and help to understand the behavior of patients with whom he works. And this will make him able to handle a patient in a good way and give the right nursing care. Third, respect. Respect is mean the patient as an individual, as human being who possesses worth and dignity. The nurse should have basic respect for patients simply as person. Respect is increased with understanding of patient's uniqueness. Respect can be seen in different ways. For example, sitting silently with patient who is crying, laughing with the patient in response to particular event, apologize for hurt, listening to patient and call him by name. Fourth, reassurance. Psychotic patients need constant reassurance as they are insecure and uncertain. They have to be helped to develop trust and confidence. Uh, so we must avoid this type of reassurance, such as "you will get well," "all will end well," "nothing to worry," "no fear is grounded." And how to give reassurance? You will pay attention to the matter that are important to patient. Be aware and accept how patient really feel. Sit beside the patient even when he doesn't want to talk, accepting patient silence. And the physical presence can be very reassuring the patient. Listening to personal problem without showing surprise or disapproval and provided patient acceptable outlets of anxiety. And we should be observe of mental ill patient is directly toward way of his behavior. Everything the patient does and say is observed by a nurse and analyzed to know and understand the motivation behind it and evaluate patient behavior as right or wrong. And nursing care should be centered on patient as a person and not on symptoms. Every behavior is meaningful and behavior is reflect in the symptom patient presents. 7 procedures should explain to patients. Every procedure should be explained at patient level of understanding. Explaining the procedure to patient will reduce anxiety and unnecessary increasing the patient anxiety should be avoided. Uh, Avoid anxiety is problem with which patient has been unable to cope. Nurse should be carefully study situation and may increase the patient anxiety. And 9, verbal and physical force must be avoided. Any kind of force applied on patient results psychological trauma. So the nurse can be prevented by carry out the procedure quickly, firmly, and efficiently with adequate help. No verbal comment should be made during procedure. Nursing team must have self-control. For belief of psychiatric nursing, first, individual has intrinsic worth and dignity. Each person is worth of respect. The goal of individual is one of growth, health, autonomy, and self-actualization. Third, every individual has the potential to change and the desire to pursue personal goals. Fourth, the person functioning as a holistic being that act on, interact with, react to environment as a whole person. And fifth, all people has common basic and necessary human needs such as physical safety, security, love and belongingness, and self-esteem and self-actualization that in Maslow theory. And six, all behavior of individual is meaningful. 7, behavior consists of perception, thought, feeling, and action. These occur in sequential manner from one perception. Thought arise, emotion are feel, and action are conceived. And 8, individuals vary in their copying capacity, which depend on genetic endowment, environmental influence, nature, a degree of stress, available resource, and all have potential for both and health. And 9, illness can be growth, producing for experience for individual. The goal of nursing care is to maximize the person's positive interaction with his environment, promote his level of wellness, and enhance his degree of self-actualization. And 10, all people have a right to an equal opportunity for adequate health care regardless of sex, race, region, ethnic, or cultural background. Nursing care is based on the needs of the individual, family, and community, and mutually defined goals and expectations. And 11, mental health is a critical and necessary component of comprehensive healthcare service. An individual has the right to participate in decision making regarding his physical and mental and an interpersonal relationship has the potential for producing change, growth within individual. This it is the vehicle of application of the nursing process and the attainment of the goal of nursing care. Because millions of people in the world live with mental health conditions, you likely encounter people with mental health in your family or in your daily life. However, if you are unsure how to best to approach someone who may be struggling, this tip may help as I will discuss next slide. We will talk to them who have mental illness in a space that is comfortable, where you won't likely to be interrupted and where there are likely minimal distractions. Ease into the conversation gradually. It may be that the person is not in a space, in a place to talk, and that's okay. Greeting them and extending a gentle kind can go a long way. Sometimes less is more. And be sure to speak in relaxed and calm manner. Communicate in a straightforward manner and stick to one topic at a time. And be respectful, compassionate, and empathic to their feeling by engaging in reflective listening such as, I hear that you are having a bad day today. So, yes, some days are certainly more challenging than others. I understand. Instead of directing off conversation at them with you statement, use I statement instead. And be a good listener. Be responsive, make eye contact with caring approach. Ask them approach question and avoid praying. Give them opportunity to talk and open up, but don't press. Share some easy insight as a way of encouraging easy conversation, such as comment about weather, community, or other, and reducing a defensiveness by sharing your feeling, looking for common ground, and speaking at a level appropriate to their age and develop level. Keep in mind that mental illness has nothing to do a person intelligence. Be aware of person becoming upset or confused by your conversation with them and showing respect, understanding how they describe and interpret their symptoms. Genuine is very important. Express your concern, offer your support, and connect them to help if you feel that they need it. Ask, how can I help? How, if appropriate, or even, can I pray with you now, if appropriate? You can say that if and give a person hope for recovery, encouragement, and prayer. If you saying, avoid saying, just pray about it. You should avoid saying, just pray about it. You just need to change your attitude. Don't say, stop harping on the negative. You should just start living. Don't say, everyone feeling that way sometime. You have the same illness as mine. And yes, we are all a little crazy now and then. All of this you should avoid saying. And thinking avoid doing, such as criticizing, blaming, or raising your voice at them. Talking too much, don't talking too much, talk too rapidly, too loudly, silent and pause, that's okay. Showing any form of hostility toward them, assuming about them or their situation, become sarcastic, making joke about their condition, don't making joke about their condition if they concern, patronizing them and saying anything condescending. Okay, and finally, I would like to share about staying mentally healthy during COVID-19 a little bit, and I share about carrying mental healthy in state quarantine in Thailand. That we know the coronavirus pandemic may be stressful for people, fear and anxiety about a new disease, and what could happen can be overwhelming and cause strong emotion in adults and children. Public health actions such as social distance can make people feel isolated and lonely and can increase stress and anxiety too. However, these actions are necessary to reduce the spread of COVID-19. Coping with stress in a healthy way will make you, the people you care for, and your community stronger. This tip trick for stay mentally healthy during COVID-19. PTMRS. P, what is that? What is mean? Pause, take deep breathing, notice how you feel, observe. And two, T is mean take a break. Take a break from what? From news, from social media. And then make them review, make them to sleep and exercise. And reach out and stay connected by phone, text, video chat. And the last one is seek help if you feel overwhelmed or unsafe. Okay, it's tip trick a little bit shortly for you all. The last one I would like to share the standard care for person in state quarantine in Thailand that I searched is from Ministry of Public Health, and I would like to present it for you all. In Thailand, according to the standard operating procedure of Department of Mental Health Thailand, which they decide to provide mental support to state quarantine facility. Mental support and care will be provided to different groups include first, quarantine individual, and second, authority involved the operation of state quarantine facility. Following procedure will be followed. First, mental for person in state quarantine, mental health support team in Thailand report to incident manager, and incident manager brief on the task of the team. And second, provide the quarantine traveler and initial screening for mental health problem as follow. Here is tool in Thailand for screen mental health. First is high-risk population identification tool. Second, stress assessment questionnaire. And third, depression assessment questionnaire, depressing screening questionnaire, and suicidal ideation assessment questionnaire. On day 2, following check-in, mental health team will send out communication materials about how to take care mental health in the form of brochure, infographic, recommendations, video clip on how deal with stress, for hotel staff responsibility for maintaining flight group. Communication will work directly to those under quarantine. And fourth, keep quarantine traveler informed available communication channel so that they can use to voice their needs and request counseling on how deal with stress via hotel staff responsible for maintaining live group communication so that mental health support team can provide help and support to individual traveler as appropriate. And fifth, maintain 24-hour mental health support hotline. That is hotline for mental health in Thailand. In case quarantine traveler Authority needs counseling on mental health every 24 hours and 6 during their stay. If they any quarantine individual found to have severe stress, increased risk for depression or suicide, or history of psychotic disorder characterized by excessive crying or violent or uncontrolled behavior, and may potentially pose danger to others. In this case, health personnel on duty should perform initial assessment by taking with them and document the incident before work with the M.Kep. M.Kep Center is a center of crisis for person in crisis mental illness. Depart of Mental Health Department Thailand by phone number as I present. So further assistance can be provided. And seven, the last one for care person in state quarantine. Upon being notified, the M.Kep Coordinating Center Department of Mental Health will dispatch its mental health support team to quarantine site in order to assess the individual. If it is determined that the individual with no suspect psychotic disorder needs immediate medical attention at a psychiatric hospital, the site incident manager should be informed. Accordingly, health personnel on duty member of M.Kep will proceed with case referral procedure via the emergency medical service hotline. Here is hotline in Thailand if a person in Thailand need to care. All action taken should be properly documented. So that's this all my presentation for students, and that brings me to the end of my presentation. Thank you for listening, for your attention. If you have any further questions, I will be happy to talk to you at the end.
Okay. Kopunka, Achan Thidarat have shared with us about very interesting topic and share her experience in mental health care in Thailand during pandemic. Okay, before the next speaker, I will remind you again, if do you have a question for Achan Thidarat, you can typing in Zoominar Messenger, especially about how care patient with mental health problem in Thailand using format that have started. Okay, now then we go to the last speaker from STIKes Hang Tuah Pekanbaru, because this is the parallel presentation is by Ners Dewi Kurnia Putri, Magister Keperawatan. Assalamualaikum Bu Putri. Thanks for coming today. Okay, I will inform to her about CV of our second speaker today. Her name is Ners Dewi Kurnia Putri, Magister Keperawatan. Her is a lecturer in STIKes Hang Tuah Pekanbaru, focus in mental health nursing. Her education history get bachelor degree of nursing in Muhammadiyah University of Bukit Tinggi, West Sumatra, Indonesia, and get professional of nursing in Muhammadiyah University of Jakarta, Indonesia, and get master degree of nursing in Andalas University, Padang, West Sumatra, Indonesia. Her focus research and publication in qualitative research focus in mental health nursing care. Okay, Mrs. Putri, Mrs. Putri will presentation about psychosocial support for mental health during COVID-19 pandemic. Please welcome Mrs. Putri. Time is yours.
Okay, thank you, Ms. Eka, for your time. Okay, I want to share to my slide. Okay, you can see my slide, Ms. Eka. Okay. Okay, thank you. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone. Okay, let me explain to related topic, psychosocial support for mental health during COVID-19 pandemic. Okay, if we talk about COVID-19, as we know, the first spread of case occurred in region. Okay, sorry. Okay, the first spread of case occurred in the region of Wuhan, China in December 2019, which was announced directly by the Chinese government. COVID-19 is a disease that spreads from one individual to another through droplets of sneezing and coughing, an estimated incubation period of 1 until 40 days. The spread of COVID-19 has continued to grow to all countries in the world, so that it is designated as a pandemic that endangers human life. Okay, COVID-19 incident is said to be a natural disaster that has an impact on biological, psychological, social, and spiritual health. Okay, next, this psychosocial change and mental health during for COVID pandemic. This is to stay healthy, we should follow health guidelines to fight COVID-19. And to be survived during pandemic, we should maintaining the availability of food and another supplies necessary for survival. And from the economic aspect, to behave frugally and managing finance. Okay, we continue to the next slide. Now, this is impact of social distancing. Okay, community and rest such as job and school are closed. Job loss, loss of medical or health resources, poor distribution of aid, and the impact are fear of catching the virus, boredom, frustration, inadequate supply, lack for information, loss of a job, associated stigma of being contaminated. Okay. Nah, next, this is group that vulnerable to experiencing the psychological impact of pandemic. Group 1 isolated due to infection, boredom, anger, loneliness, and symptom of viral infection, cough, and fever. Also cause psychological distress and anxiety. Group 2 is living in a healthcare institution or facility that requires a long period of care. The elderly with health problems are at risk of infection and serious psychological and mental condition. And group 3 is elderly, experience psychosocial problems such as stress, anxiety, depressive symptoms, insomnia, denial, anger, and fear. Okay, next, group number 4 is chronic disease group. Is people with diabetes, heart disease, lung disorder can be infected for a long time. And the group with low immune system, people with mental health problem, people with mental disorder, and drugs problem. And next, hot workers are prone to experiencing emotional distress due to exposure to COVID-19, anxious to transmit to their family, limited personal protective equipment, very tired, and conflicted in resource allocation decisions. Next, I will tell you several signs of psychosocial change and mental health during the COVID-19 pandemic. Okay, number 1, fear and anxiety, depressed and bored, feeling socially isolated, angry, frustrated and irritable, changes in sleep patterns, change in eating habit, deteriorated mental health condition, increased consumption of alcohol, cigarette, and drugs, avoiding health facilities for fear of being infected. Then prevention and management of psychosocial problem in society during COVID-19. For the general public, stick to reliable information, limit media input, create a daily activities, take good care for your body, drink less coffee, stay connected, prepare supply of drug, vitamin, mask, avoid burnout, and try new things. And next, for the mental health problems, continue therapy and watch for worsening signs and symptoms. Immediately consult a psychiatrist or mental nurse if you feel your psychosocial condition is disrupted. Okay, in the last few months, we start a new normal. So I want to explain the behavior change after COVID-19 pandemic. And okay, these several conditions that we can see today. Example, number 1, the social barriers are beginning to be loosened to allow an increase in confirmed case. 2, increase anxiety because the cases are increasing. The work tend to do all activities at home such as work, school, meetings, scientific meeting, graduation from home, and traveling virtually. The fear of being infected is getting more intense. Afraid for crowd and using public transportation, using a mask. There is no physical touch. Individuals are required to be able to be disciplined in carrying out health protocol when doing activities outside the home. The ability of new work area related to hygiene maintenance, such as media for washing hands. So teleworking is increasing as technology in doing internet-based work and business. And the positive impact that we can feel from the COVID-19 pandemic are increased clean lifestyle in community, provide a family with an opportunity to know each other more, improving interaction in the family, learning process in completely addressing problems, cooperating with the social environment to prevent stigmatization, and make a new hobby. Okay, thank you for everyone. Then that's all my presentation. For the next session, I will to the moderator, to Ms. Eka, please.
Okay, thanks, Mrs. Putri, for your sharing about the topic. And for our audience, just one question. For our audience, if you have a question for Mrs. Putri, you can type in Zoom Messenger. And we are come to the next session, is discussion session. I have one question for Achan Thidarat. The question are from my student, Fauzan, ask about patient with lack.
From Thailand.
Yes.
Okay.
Okay, Achan, can you hear me?
Yes, I hear, I heard.
Okay, there is a question for you from my student. His name is Fauzan. Here ask about you. Here ask about a patient with lack of insight. How manage a patient with lack of insight?
Thank you for interesting question. Patient who lack of insight is schizophrenic patient. Most of them lack of insight. So
when we saw them or talk with them, you will present reality for them. First of all, you will accept them, accept all everything that they said. They present to us, and then you will present reality for them. Now you stay here and you will talk with me as a nurse, like something like that. Thank you.
Okay, thank you for your answer, Achan. And there is a problem with with Zoominar Messenger, so I want say to audience, if do you have a question for Achan Thidarat, you can raise your hand in this Zoominar, so you can ask direct direct question for her.
From my student or from student Indonesia, second question.
Yeah, okay.
Thank you very much. That is so very interesting question too. If you have depressed or stress during every time, not during pandemic or at home, first of all, I advise, first of all, you will consciousness. You know, consciousness is mean you know how you feel, and you will observe your feel, observe your emotion. You will bore, you will anger, something like that. And then maybe you can start to have activity in your home with someone in their home, or you will start to exercise in there every day, 30 minutes every day, or 30 minutes 3 times เขาเรียกอะไรนะอาจารย์สามครั้งต่อสัปดาห์ 3 times 3 times per week. That is increase your mental health, because it's increase, that is serotonin. Your serotonin increase, you will happy and don't have depressed emotion.
Okay, thank you, Achan. There is one question. Okay, wait a few minutes. Okay, I will look at in Zoominar Messenger. There is no question because there is a problem with Zoominar Messenger. If do you have any question for BCN Surin from Achan Thidarat from BCN Surin, Thailand, you can raise your hand again. Nggak ada pertanyaan. Aku nggak bisa lihat ada yang. Oh, Liski. Oh, wait, I get one student, maybe from my student for Achan Thidarat. Liski, you can active your speaker. You can ask a question.
Mental health in a pandemic 19.
Yes.
That slide that I present for you. First is pause. Pause means take a breath, deep breathing during you stay with pandemic. Okay, I know. I'm sorry. In Thailand, have M.Kep center.
M.Kep Center can help them every time, everywhere that they need to consult, and we have hotline mental health too. Uh, they uh, they can consult everything that they need to help 24 hours. That is procedure in Thailand.
You are speaker mode, Ajan. I can hear you.
So I just like read the question. So it's very interesting question that ask about how to keep mentally healthy for women in perinatal period during pandemic of COVID. So actually, I'm going to talk about this topic on December 21. However, I just like inform you that for every pregnant women, when they visit antenatal clinic, we will ask them to use questionnaire to assess about their mental health. We use 85. So if they have the risk for depression or some mental health problem, we will inform them to visit the psychiatric department, and then they can like a consult. Other, if they have like a very seriously mental health problem, we can at hospitalize them for other help. So that's just like a brief information about how we cope with the mental health problem for pregnant women. And I will give you more detail on December 21. I'm going to show you the tools that we use to assess mental health problem in pregnant women.
Okay, Ajan, thank you for your answer. What?
Pertanyaan Liski belum kah?
Kakak. Sorry for
In
uncomfortable.
Thailand, we have mental health assessment during COVID-19 from Department of Mental Health Thailand. That is standard tool for assess mental health of person during stay with COVID-19. And my student assess as and my student assess by use this assessment tool. Its name anxiety assessment of COVID-19. Yeah.
Okay. Thank you, Ajan, for share your experience about mental health nursing, especially in Thailand. Okay, I must cut the question because we have still have the second speaker, and thanks for your answer, Ajan. Okay, I will continue next question for the second speaker. The question is from Lilis Azura Damayanti. She is my student. Okay. She is asked about, as we know right now for wait, I think Putri ada. Mrs. Putri, can you hear me?
Yes, I can hear you, Miss Ika.
Okay, you are ready for answer the question?
Okay.
Okay, I have one question for you.
Yes.
Now I will reading the question for you. Okay.
Okay. Yes.
Okay. As we know, right? The question is, as we know, right? Now we stay at pandemic and study from home. Actually, we get stress during study and home with assignment. We must finish it every week. And the question is how we must handle ourselves for not stress and not be depression during study at home like this. Thank you.
Okay, thank you, Miss Ika, and thank you for Liz. Yeah.
Would you answer the question with Putri?
Okay, thank you. Okay, for Liz, you asked me about academic stress and how to handle it. You make a plan, set your priority, and do it one by one until finished. Do not pending. Take a rest. If you tired or born, just take rest. And your first speaker, sorry. Sorry. Take a rest if you train and born. Just take a rest. And your first speaker one, Miss Thidarat have taught you PTRSM and do and you apa? And you can do it. This Miss Thidarat yang apa sih? And you can practice PTRSM and do it. Thank you, Ms. Thidarat, for suggestion for my students.
Okay, thank you, Mrs. Putri. And we have 4 questions, but just from my student. Maybe from a question from a student of BCN Surin, Thailand. Any question? If do you have a question for our speaker today, you can raise your hand or you can typing in Zoominar Messenger. For BCN Surin Thailand student, there is a question for our speaker today.
Right now we have no questions from our students.
Okay. Thank you, Achan. Okay. Cukup. Okay. Finally, we have we have come to the end part of our virtual class, and a really great topic today. And from the topic, we acquire knowledge about mental health care, especially in pandemic situation, especially in Thailand and Indonesia, right? And physiological aspect also important because physical aspect support the physical to maintain health well-being. Whereas a nurse, we must provide comprehensive nursing service including physical, psychological, social, cultural, and spiritual, and not focus on just one aspect. Okay. And then I would like to say thanks again to the speaker have shared her experience about mental health nursing care. Khopun ka Achan Thidarat, thank you very much.
Thank you very much.
Mrs. Putri, and for BCN Surin Thailand, thanks for partnership and collaboration in this event. Hopefully, for the next year, for in the future, we will organize another agenda again. Okay, and thanks to all audience have joined with us, and I hope the virtual class will be beneficial for us. Thank you for your attention. Assalamualaikum warahmatullahi wabarakatuh. Sawadika, good afternoon. I return it to MC. MC time is yours.
สวัสดีค่ะ ขอบคุณค่ะ Thank you very much. I'm very pleased to meet you again.
Thank you very
Tomorrow.
much.
Bye
Yeah,
bye.
but MC, you're not closing yet. Where is MC?
Thank you, Miss Eka. To the audience, please to fill your attendance in Zoom seminar. Ladies and gentlemen, those are the agendas we have present to you today, as we have finished our virtual guest lecture in December 15, 2020. As the master of ceremony, I would like to thank you to all of the speakers, the committee, and the audience entirely. Thank you for making in time in your busy schedule to join us here. We wish you all a pleasant day, and for the students, we hope the lesson from speakers will improve your comprehension learning in mental health nursing. Finally, it's time for me to end the event today. See you in second day virtual guest lecture on December 18, 2020. Let's close our event for today by saying Hamdallah, Alhamdulillahirabbil alamin. Thank you very much. Sawadika. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you very much.
Thank you very
And
much.
see you again this
See you.
Friday.
See you again. See you again, Aja.
Thank you. See you again.
ขอบคุณค่ะบายบายสวัสดีค่ะ
Bye.
See you again and have a good day.
Have a good day too.
Yeah.
Excellent,
Don't forget to
very
list. Don't
Good
forget
job.
to fill the attendance list in link in chat, Ajan, to your students.
Yeah. My IT man already sent that email to our students and our faculty members to complete that form. Yeah.
Okay, thank you.
Okay, see you Friday.
See you in Friday there. See you.
See you. Friday I'm at 10.
Yuk, mahasiswa Hang Tuah, tolong diisi ya link absensinya ya. Ada di kolom chat.
Bu Siska.
Iya, Beraja.
Masih ada yang waiting itu loh di apa? Waiting room.
Ya, udah telat dia masuk sesi jam 5 mungkin.
Iya, nggak di accept lah.
Accept aja.
Sukses ya.
Alhamdulillah.
Kapkunka itu apa sih artinya?
Salam, kayak salam gitu.
Kak Menti.
Enggak dulu. Oh iya.
Bu Menti.
Bu Menti. Bu Menti. Apa kabar, Bu? Iya.
Masih mute.
Sudah selesai, terima kasih. Sampai jumpa tanggal 18 ya semuanya. See you and December 18.
Oke.
Thank you.
Insya Allah.
Alhamdulillah.